Hi, it's Dr. Blanchett again. So today I thought we were going to talk about some content, right? So we're going to start talking about the foot and ankle. What I had said before basically is that we're going to start talking about some different pathology. Let's say like, for example, a bunion, gout, ankle fractures, things like that. But I was thinking to myself, before talking about what's wrong, we should talk about what's normal, right? So I thought maybe we're going to do a little anatomy class today. Today we're going to go over the bones of the foot and ankle. I think this will be interesting. Like I said, you should know what's normal before knowing what's wrong. So let's get right into it. First of all, let me say that there's a debate about the number of bone that's in the foot. If you look online on Google, it's going to tell you there's 26 bone. I disagree. I believe that there's 28 bones. And then the reason why is because there's those two little bones on the bottom. They're called the sesamoid bones here on the bottom of the big toe. And they are very important. We walk on them every day and they can break, they can hurt you. So I think we should count them. So in my book, there's 28 bones. If you look on Google, it's going to say 26. So don't say that I'm just wrong. This is just my theory because I want to include those little sesamoid bones. We have typically 5 toes. There's some people that have more toes or less toes, more of a rarity. So let's just focus on what's normal right now. And so what's normal is to have usually the lesser toes. So when we're talking about the lesser toes, is the second, third, fourth, and fifth toes here. They have usually 3 bones. So they have a proximal phalanx, a middle phalanx, and then a distal phalanx. On occasion, like actually in my model right now, the 5th digit, the last 2 are going to fuse together, like it is in here right now. Actually, it's funny. This is called a synostosis. There's nothing much to do about it. It just basically, some people are going to have a fusion between those 2 bones. This is just genetic. And then sometimes you can have more like a hammer toe, because basically, if you have a hammer toe, which is when the toe is starting to bend down, and if it's bending all of this bump here, so then this can go up a little bit more and then just rub in the shoe instead of bending, like at this joint and then that joint. Fun fact, there are 7 tendons that have to work in harmony in order, when you're walking, to have the toe remaining straight. So oftentimes people are asking me like, why do we get hammer toes? Hammer toes, like I said, is like when the toe is being crooked like this. And then this is because when there's an imbalance between the long muscle that are coming from the legs and then the tiny muscle that are coming from the foot. The long muscle that are coming from the head, they call the extrinsic muscles, and then the intrinsic muscle coming from the foot. So for each toe, there's approximately 7 tendons that have to work in harmony for it to stay straight when we're walking. So this is why what happens sometimes, you're going to have some overpower of the long muscles, and then the small little muscle here, they're having some trouble, and then at some point, it's going to start to become crooked. They can get broken because, oftentimes the little toe can get snatched in the furniture. Another misconception is that some people, sometimes they think that there's nothing that can be done for a toe fracture, and then that, if you fracture your toe, the doctor's not going to do anything. So it's not really true. So first of all, the first thing that we do, we assess to see if there is or not a fracture. So basically that's with an x-ray. If there is a fracture and it's non-displaced, so then we can tape it with the other one. Sometimes it happens that the fracture is actually displaced, and then some people may need surgery. Sometimes it's intra-articular, more risk of having arthritis in the future. So all those things are kind of like important. So like if you hit your toe and then you're still having pain or like a lot of bruising, a few days, weeks later, just go and consult. It's not true that nothing can be done for toe fractures. Okay, now we're going to move on to the big one here. As you notice, the big toe, which is called hallux, Hallux, is the scientific term for big toe. He has 2 phalanges. See, 1, 2, 3, and 1, 2. 2 phalanges on the side here. If we move forward and then we look on the bottom here, those are the sesamoid bones. So the sesamoid bones are the one I was saying earlier that are not really counted usually when we count how many bones are in the feet, and that I count because, like I said, they can break, they can hurt. They cause often trouble in people that have a high arch foot, like a caved foot. They're walking basically like this, and they're walking boom, boom, boom on those little bones on the bottom there, and that's called sesamoiditis. And like I said, they can also break. So those are the sesamoids. And then if we continue moving, so now we have the metatarsals. So the metatarsals here, something that's interesting to note, a few things. The lesser metatarsals, like we talked about earlier, second, third, fourth, and fifth, their growth plate, they're located at the metatarsal next. So right here. So if you take an X-ray of a young child foot, you're going to see that there's a break here because the growth plates are made out of cartilage and you don't see the cartilage. For the phalanx, the growth plate are at the base. So at the base here, at the base here, base here, base here. The first metatarsal is acting as a phalanx. So basically, the growth plate is at the base here. It's not at the top over there. The hypothesis is that this was basically like an opposable thumb over here, and then now it's just acting as a metatarsal. It's kind of like one of the most important bone of the forefoot, because when we're walking, this is where all the weight goes. There can be a lot of patients that can develop arthritis over here. Sometimes I call the first metatarsal lazy in some people, especially with that have flat feet. So sometimes what happens is that you stand up and then the foot collapses down this way. And then as it collapses down, the first metatarsal kind of like lays up in the air like this. And what happens, it can be causing a lot of trouble because first of all, if it's up in the air, when you're walking, you're gonna have trouble rolling on this joint here on the first metatarsophalangeal joint. So first metatarsophalangeal joint. You can have some trouble doing this. And then it's gonna cause some rubbing and it can cause some bone spur and some arthritis right on the top here. The other thing that can happen when the first metatarsal is lazy, you can have more pressure going at the second metatarsal, and then that can cause a lot of issues also with some ligaments disruption on the bottom here. There's a very important structure, it's called a plantar plate, and it's on the bottom of the second metatarsophalangeal joint. And if this one, the big metatarsal, is not doing its job, so then this tiny little second one is going to have to work a lot more harder, and that can cause issues. So those are some things that I see in my practice often. The other thing also that's notable with the first metatarsals, sometimes people have bunions. So a bunion basically is when the first metatarsal is deviated medially. Medial is towards the inside of the body. So it's going this way, and then the big toe goes this way. So that's called a bunion. All right, so I think we're done with first metatarsal. The second, third, and fourth metatarsal, some things to say is that this one sometimes can have stress fracture, the second metatarsal, especially when the first is not doing its job, and then there's a lot more pressure. Sometimes also the second metatarsal can be actually elongated, and then there's a lot more pressure that goes on it. Third metatarsal, there's not much to say about it. And then the fourth and the fifth also sometimes can have stress fractures, and sometimes it can happen when people actually have a high arch foot, like we talked about before. High arches like this. People like that, they walk with their foot a little bit at an angle. That's how I explain it to patients. I exaggerate it, but I'm always like, no, it's kind of like walking on the side of your foot. And then what happens is that there's a lot of stress that goes on the fifth and the fourth metatarsal, and they can have a stress fracture. All right, move on to this bump here. So there's some people that are gonna say, they come to the office, they're like, I have a bump on the side of my foot. And they think it's abnormal. But it's actually normal to have a bump there, clinically in the bone. This is called the styloid process of the fifth metatarsal. And this is the insertion of a tendon. So basically, bones are living things. So when something is inserting on somewhere and it's pulling on it, so it's going to cause a protrusion. So there's a tendon, it's called a peroneal brevis tendon. It starts from the ankle here and then goes around the foot. And it inserts right there on this bone. And because it's pulling on it, as the bone grows, there's going to have a protrusion here. So that's normal. But when people are seeing it more, it's when people are actually have a high arch foot deformity, or sometimes even the metatarsus adductus, meaning that the metatarsals are going this way. So then you see if I'm doing this, it's protruding more on the side. And then that's when sometimes it can be under on the side of the foot. All right, now we're pretty much done with the metatarsals. We're gonna go in the midfoot. So in the midfoot, those three first bone over there, 1, 2, and 3, they're all named cuneiforms. So cuneiforms, there's the medial, the intermediate, and then the lateral cuneiform. They all work together to enclose the second metatarsals. You see how the second metatarsal is kind of like a little bit recessed here? This is a really important articulation. This is called the Lisfranc joint, and it helps hold the midfoot, the middle foot, together. So some people can have an injury. Let's say if they walk into a pothole and then their foot does like this, as you can tell, not too good for the Lisfranc joint, or like the whole torso of the tarsal joints. They can peak up, they can have fractures over here, and then they can have instability of the ligaments in between. And then what happens is that the ligaments are not holding everything together anymore, and then there's a high chance of arthritis. And usually what we recommend for a Lisfranc injury is to do surgery. So those are the cuneiform here, and after that we move on just behind to the navicular. The navicular has a bump also, a little bit similar to the fifth metatarsal base that we saw earlier. It's also coming from a tendon. The tendon is a posterior tibial tendon, and it comes on the side of the ankle here and then goes all the way down to the navicular. And then there's also many different attachments, but the main attachment is at the navicular bone. This can be sensitive also. This can be painful sometimes. There's a lot of people that can have posterior tibial tendinitis, and it can be insertional, meaning at the insertion of the muscle into the bone, or it can also be non-insertional, which is basically it's along the course of the tendon. Another thing also to note here, sometimes you can have an extra bone there. So an extra bone there, it's called an os accessory navicular. So it's kind of like another navicular. And then that also can cause a lot of discomfort as symptoms of tibial tendinitis, but you just have like an extra bone that's over there. Then we're going to move on to the cuboid. So the cuboid is right here. It is between the fourth and fifth metatarsal and the calcaneus, which is the heel bone. The cuboid has some things going on with him. There is a tendon that comes, so you remember earlier I was talking about peroneal brevis tendon that inserts into the fifth metatarsal base. There's also a peroneus longus that comes here and then goes around here and then goes all the way and attached to the base of the first metatarsal. It goes right next to the cuboid. And the cuboid is important with the navicular into motion, the midfoot. Now we're going to go to the talus. The talus is one of the bones of the ankle. Fun fact about the talus is that there's no tendinous insertion. It's the only bone that has no tendon that goes and insert on it. And then also it is made out of, I don't like the exact number, I would say about 90% of cartilage. So you can see there's cartilage on the top, cartilage on the front, cartilage on the bottom. So this is a very important bone. And this bone is basically connecting the leg to the foot. This bone can have a few different injuries. You can have a fracture at the talar neck over here. And then what happens with that is that if there is some displacement, we can have a rupture of some of the arteries that come and nourish the bone. And you can have a delayed healing, or you can have a non-healing. And then you can also have something called avascular necrosis. So avascular necrosis, it's when the bone starts to die, basically, because there's not enough blood flow going to there. And then this is when you have an injury there. It comes from usually a high impact injury, like a motor vehicle accident or like a fall. Next bone is the calcaneus. The calcaneus is the heel bone. So the heel bone has a few different insertions that are important. The Achilles tendon inserts in the back here. So when it inserts in the back there, and if there's a lot of tension, the Achilles tendon and the calf muscle, people can start having spur in the back. So posterior, meaning in the back, heel spur. And they can be painful. They can rub in the shoe. Some people, sometimes they're going to need surgery to fix it and to correct it. You can also have a plantar heel spur. So when we're talking about like the heel spur, the most common heel spur, usually it's the bottom one. So the bottom one is related to the plantar fascia. So the plantar fascia is a structure that starts from the heel here and goes all the way at the front of the foot here. When you're looking on the bottom, there's one insertion here, and then there's 5 insertions at the front of the foot here. So basically a lot of tension goes through this portion. And if you have a patient that have either high arch foot or flat foot deformity, there's a lot of tension through the plantar fascia. So it's from different reasons. So in the high arch foot, if you have the foot more like this, and then every time that you walk on it, it's like a bridge. So it's pushing here, and it's always trying to bring these apart when you're walking, and it's going to be causing a lot of tension through the plantar fascia. And the plantar fascia is going to pull on the bone, and then by pulling on the bone, at some point, like I said earlier, the bones are living things. If there's a lot of tension there, there's going to be creating more bone, and then that happens, that creates a bone spur. In flat foot deformity, it's a different mechanism because when the foot is not flat, so basically it's going this way more, still pulling through the plantar fascia, and pulling on the bone, causing a bone spur at some point. You can also have a fracture of the calcaneus. You can have a traumatic fracture, usually people that fall down, let's say a ladder or a roof. So that's the traumatic one. And then what's really dramatic with the traumatic calcaneal fracture, what is important to note or to see or to assess is what's going on with this joint here. This is a subtalar joint, and this is the posterior facet, this one in the back here. This is very important. When somebody falls from a height, the talus is driven into the calcaneus, and this facet here can become depressed. So you see how the angle, but then it can become like this. So then we have to go in and fix it and bring it back up. And that's kind of like a tragic injury, because a lot of people are going to have, even with the best repair, a lot of people are going to have arthritis in the future. The other injury that can happen to the calcaneus is stress fracture. So that can be seen often in patients that are going to be starting to walk a lot or starting to run a lot or to exercise and things like that. And then they're like going to be like pounding a lot on their heel. So then you can have a stress fracture over here, and then they need to rest and then let that heal. You need to let your heel heal. Yeah, I did that. Okay, and then the last two bones, they're not in the foot anymore, but they're of the ankle or of the leg. And this is the tibia, which is towards the inside, so towards the big toe. And then this is the fibula that's on the side here. They can get broken. Ankle roll, if you roll this way, there's some ligaments, so this can hit this can break, this can pull onto this area. There's all sorts of different mechanisms of ankle fractures. One of the most common one is basically supination external rotation. Basically the foot is like this, and then the leg and then the foot is kind of like rotating this way. It's gonna break this one with an oblique. And it can break the medial malleolus also. And both of them are broken. It's called a bimalleolar ankle fracture, and it's considered an unstable fracture, and then it needs to be fixed. An ORIF, which is an open reduction and internal fixation with plates and screws. All right, I think I said a lot about the feet. I hope this was interesting. I mentioned a lot of different things. If you have any questions about any of those pathologies that I mentioned in the video, comment down below. Let me know what's your question, and let me know if you have any future topic in mind. And then next week I was thinking about doing more of a review of the tendons that are present on the foot and ankle. And after that, we'll start more talking about some pathology. Until then, if you like this content, please subscribe and like this video. There's also comment on the bottom of the video to ask me some questions or also to request some topics for future videos. I'll see you on the next video. Thank you.